Mr. George Williams is a 79-year-old man who is divorced and lives with his oldest daughter Tina and her 3 children. He retired from working 14 years ago, describes himself as a, quote, man of faith, and identifies as Baptist. Medications: losartan, iron, diltiazem, warfarin, ritonavir, efavirenz, lamivudine, methadone. Mr. Williams came to the hospital emergency department with flu-like symptoms where he tested positive for COVID-19 and was transferred to an isolation unit. Within a few hours, his oxygen saturation began to decrease to the upper 80s, and he was started on supplemental oxygen via nasal cannula. Overnight, his oxygen saturation continued to drop, despite escalating levels of oxygen support administered through nasal cannula.
Hi Sylvia, I'm Suzanne. I'm the pharmacist on the Palliative Care Service, and we were consulted on Mr. Williams today. So I'm going to be reviewing his medications, assessing his symptoms in light of his medication history and his clinical condition.
Hi Susan, I'm Sylvia, a nurse on this unit who is caring for Mr. Williams. Thank you for coming, and to give you some background, let me look at my chart. And Mr. Williams, he is 79 years old Caucasian male with a history of chronic kidney disease, atrial fibrillation, HIV, and substance use disorder. He presented to the ED with chills and a temperature of 39.2 Celsius. For the past 3 days, he has increased fatigue, loss of appetite, and shortness of breath. He developed a sore throat, cough, and muscle pain the day before the admission. His family urged him to seek medical attention, but he refused it.
Thank you for that history. How is he doing today?
So this morning, Mr. Williams experienced the same symptoms, so his grandson called 911. Upon arrival, he was tested positive for COVID-19, so he was brought to the intermediate care unit. He had sharp pleuritic pain that worsens with coughing, and he is hemodynamically unstable.
In light of that, I think we'll probably recommend acetaminophen, 1 gram orally every 6 hours for the pain. If that's not effective, we can add oxycodone 5 milligrams for mild pain and 10 milligrams for more moderate pain. We're going to have to be mindful of his kidney function and the fact that he's anticoagulated. So we're going to avoid medications like nonsteroidals. And given his history of substance use disorder and his methadone treatment, we're going to have to remember that he's more tolerant and may need higher doses of pain medicine.
Hi, I'm Ben. I'm the nurse practitioner on the unit. How's Mr. Williams?
Hi Ben, I think that Mr. Williams' shortness of breath is getting worse, even with his increased oxygen.
Okay, I think we'll need to go from nasal cannula to high flow nasal cannula, 40 liters, 75% FiO2.
Thanks. I'm going to get vital signs and give a dose of acetaminophen for pain, so I will keep everyone posted.
Thanks.
Post-vital signs.
Ben, I'm very concerned. His oxygen sats are down, but he's already on high flow nasal cannula.
Yeah. I think we need to think about making him NPO, getting a set of ABGs, and start thinking about transferring him to the ICU.
I agree, and I think we need to transition his oral pain medicines to an IV PCA, and then add a continuous rate to address both his pain needs and his respiratory needs.
In Mr. Williams's hospital room.
Hi, Mr. Williams. Hey, can you hear me? Hey, how are you feeling right now?
I'm really working.
Yeah, that makes a lot of sense. Your body's having a really tough time breathing right now. Yeah, in fact, we've got you on pretty powerful oxygen right now, and still your body's not getting enough oxygen. I think your lungs are getting sicker and sicker. I'm sorry, I should have introduced myself. My name is Ben. I'm the nurse practitioner taking care of you today. So, Mr. Williams, I think we should get one of your family members in on the phone to start talking about next steps and how we're going to help your lungs right now. How does that sound?
Good.
Okay. I saw in your chart that your daughter Tina is your emergency contact. Is that who you want me to call?
Yes, please.
Okay. I'm going to get her on the phone now. Hi, Tina.
Hello?
Hi there. This is Ben. I'm the nurse practitioner taking care of your dad at the hospital.
Oh, thank you so much, Ben. Thank you for calling.
Of course, I'm so glad you could talk. Look, I'm sorry you couldn't be here in person, but with COVID, we just can't let anybody in. I'm so sorry about that.
Ben, I've been so worried about my dad, especially because I can't be there. Can you tell me how he's doing, please?
Yeah, I completely understand. So I'm with your dad now. Mr. Williams, look, it's Tina.
Hi, Dad. Oh,
Yeah, so Tina, Mr. Williams, you're in a pretty rough shape right now. You're having a lot of trouble breathing.
Yes.
Yeah, Tina, we have him on a machine called a high flow nasal cannula, which is giving him a whole lot of oxygen. And still his lungs, Mr. Williams, your lungs, they're a little too sick or getting sicker, and they're not really taking in enough oxygen. So I'm concerned that what might need to be the next step is to do what's called intubation, which is when we use a tube connected to a machine to help you breathe. That tube goes down the throat, and it helps your lungs breathe better when they can't breathe for themselves. But I wanted to talk to you guys about that and see if that felt like the right thing to do next.
Daddy, what do you want to do? This is such a shock.
I want to live. I don't think it's my time. Do what you can to keep me alive.
I'm sorry, I'm just not sure what to do. What would you do now?
Yeah. So let's talk about that, Mr. Williams. If I understand correctly, you're saying that you want to live, that it's not your time. And right now, I think the best way to keep you stable, keep your lungs breathing, is in fact to potentially go ahead with the intubation, like we were saying. I do want to be clear about something. I want to have open eyes about this. That we're not sure that you will be able to come off of that machine because your lungs are really that sick. And I want to talk about that clearly before we go ahead.
So what are the next steps?
Yeah. So the next steps, Mr. Williams, I think we're going to send you to the ICU where they can take really good care of you, make sure you're comfortable, and use that tube to help you breathe if you need it. In the meantime, Mr. Williams, I wanted to clarify, if you're not able to speak for yourself, who would you want to speak for you?
My daughter Tina, she knows best.
Tina, did you hear that?
Yeah, it's happening so fast. I'll do whatever you do, Daddy.
Okay.
All right, I think we'll get you to the ICU then, and they'll take really good care of you there. Tina, we'll be in touch, okay? And we can talk every day, just like this.
Thank you, Ben. Thank you.
Of course, thank you. All right, say goodbye, Mr. Williams.
Love you.
Bye, Dad.
Care Team Zoom conference call with family.
Hi, everybody. Tina, thank you so much for joining us on this remote meeting. I'm sorry to say, your dad's care has become more complex, and I was hoping we could take a moment to talk about it and see what the next best step is going to be for him. So if you don't mind, we can all introduce ourselves and we can get to discussing that. I think you know I'm Ben, the nurse practitioner.
Thank you, Ben.
So my name is Sylvia. I am a bedside nurse for Ms. Williams.
Yes.
Hello, Miss Williams. I'm Tamikia. I'm the chaplain here at the hospital, here to offer you and your father any spiritual support that I can.
Thank you, ma'am.
Hi, Miss Williams. I'm Suzanne. I'm the pharmacist on the team that's been working with your father and the rest of the team to help manage his medications and symptoms.
Thank you.
Hi, I'm Dr. Rob. I'm one of the palliative medicine doctors. I take care of people with serious illnesses like COVID, and I help see if I can help them feel better. I also talk about things that are really important for your dad and people like your dad to get a better sense of who they are so we can actually give them the care that they need. And so we want to do what's best for your father, and if you can tell us a bit about your dad, it would help us get to know him better, and so we can actually give him the care that he needs.
Sure, my father lives with me and my three grown children, and we're all very close. He's a very hardworking man. He was a long-haul truck driver and has been retired for the past 14 years. He's always been such a good person, and he loves his grandchildren. He's a Baptist, and I think that his faith has really helped him with his sobriety for the past 20 years, so more than 20 years now.
Well, thank you for sharing that with me about your dad. And did you ever speak to each other about medical decision making, about what his wishes are?
You mean like if something happens?
Yes.
He's not written anything down as far as his medical wishes, but my father's a strong believer in God and in life after death. He believes that when it's your time to go, you go. But he's always been a fighter. He's worked really hard on his recovery.
Okay. Well, what I hear you saying is that your dad's someone who's very strong, who's always been hardworking, and he's very faithful. And so what we're going to do is do all we can to help him. And I think one thing you've said is that he believes that when it's your time, it's your time. And I think time will tell us when that is. And in the meantime, I'd like to ask the medical team to talk to us about how he's been doing, actually. Would that be okay, Tina?
Yeah.
Thanks, Tina, and thanks, Dr. Rob. Yeah, I'm happy to provide a little medical update. So, Tina, last time you and I spoke, your dad was having so much trouble breathing that we had to intubate him. And that hasn't changed. He is stable on the machine, but he's not able to come off of that machine yet. It's, not enough time has passed. We haven't been able to get him off. Unfortunately, Tina, something else has come up too. I don't know if you recall that your dad has what we call chronic kidney disease. In other words, his kidneys have been pretty sick for a long time. They're not doing well right now. In fact, they're doing worse. To the point that I'm starting to think that we may need a machine for the kidneys as well. We call that dialysis.
I can't imagine that my dad would ever want to be on dialysis. I don't think he'd want to be dependent on any machine, and now you're talking about two. I don't know what to do. This is all happening so fast. I'm just not ready to lose him.
Yeah, I mean, I can see how much you love your dad, and this is really hard. The one thing is, this is not a permanent decision, or at this point, irreversible yet. And we're looking to get him over this crisis and see how he does. There is a possibility that he may require lifelong dialysis treatment, actually.
Last, when he was still able to speak, he said that he wanted me to do everything to help him live, and right before we put the breathing tube in place, and I do want to give him a fighting chance. So maybe we should try the dialysis, as maybe that'll just, help his kidneys come back and start working again. Is there a chance for that?
Yes. And so, I think what we can do is we can give him a trial dialysis and see how that works. And then we're going to need your consent to place a temporary dialysis catheter. And once we begin dialysis, we'll be able to tell if his body gets a bit better or not after a few days. And he needs support right now while he's in shock. This may not necessarily be lifelong. And again, this is not a permanent decision, and you can change your mind depending on how he's doing and what you think he may want at that time.
Yeah, I think I'm okay with that. So I'll give my consent for the dialysis, but can I just ask you one question? I'm just really concerned about this, and is my dad in any pain right now? I just don't want him to hurt through any of that. Okay.
Sure. Miss Williams, your father is currently receiving fentanyl and midazolam medications. Those are helping him with pain and sedation. So he's comfortable, and it allows the ventilator to help him breathe so he doesn't have to work so hard.
Thanks for explaining that.
And while we're reviewing his condition and plan of care, we want to ask you about other life-sustaining measures that we might think we may need to consider.
Yeah, we're all hoping and praying with you that he will get through this, and sometimes it's helpful to kind of hope for that while we plan for the other things that could happen. Is that okay with you? Okay.
Thanks for helping me understand. I mean, this is all just this is all just so shocking to me.
Yeah, it's such a shock. If he was, I'm sorry that we even need to think about this, but I think it would be in his interest to think about, if his heart were to stop, would he want us to start his heart back up again? We call that CPR, with those compressions, strong medicines. Is that something he would want?
I don't know right now. I'm not sure.
That's okay. That's absolutely okay.
Okay. And Tina, I'm just going to add in here that, we're going to do all we can to help him and see if we can give him more time to get better and recover. And at the same time, I think what Ben was talking about is, I think one thing he said earlier was if he died. He mentioned that he'd probably want to, when it's time to go, it's time to go. And it's essentially, I think if his heart were to stop, that's an indication that he's died. And what we'd want to consider, and again, this is not something that we need to do right now, but it's something for us to start thinking about and planning for the future.
Okay. Thank you for explaining that.
Tina, I know this is a lot of information to take in right now. Is there something that might be helpful for you in coping with all of this information?
I'm really just not sure right at this second.
Well, know that we are here for you.
I appreciate it, and I thank all of you for being here for me.
You're welcome.
All right, so Tina, if it's okay with you, we'll check back in just like this. You know, we can have more conversations. It's all an ongoing process here. We're going to do everything we can to keep your dad breathing, his kidneys working, and like you say, keep him comfortable. We're going to do our best to do that all at the same time, and we can readdress as we see if he's able to come off some of these machines. Okay?
Yes. Please do keep me updated.
Absolutely, we'll do.
Family meeting 20 days later. There has been no progress on weaning from the ventilator, and the patient is still requiring CVVHD and vasopressor support.
Tina, we're meeting today, as you know, to review your dad's situation.
Yeah.
And what I'll do is I'll have, I think it'd be great if Ben gave us an update on what's been going on with your dad the past several weeks.
Absolutely.
Thank you.
I can give a little bit of a medical update. Tina, so he's still on the breathing machine and needs as much support as ever. And we're now past 2 weeks. We're almost, I think, towards 20 days that he's been on that ventilator. And in that time, he's also needed really powerful medications we call pressors to keep his blood pressure up. And then, as we discussed last time, he has been on dialysis. Actually, a type of dialysis that's round the clock. He's always on it. And all of that together, you know, they're keeping his breathing and his vital signs stable. But without those machines, he would not be doing well at all. I want to be upfront about that. One thing we can discuss today, we don't need an answer right away, but one thing to discuss is that generally it's not very safe to keep him on this breathing machine much longer than he's already been on. And so we have a question for you, which is if you think that he would want to undergo a surgery that moves the breathing tube from inside to outside his body through his neck. We call that a trach. And then the other thing to potentially talk about today would be how are we going to feed him right now? How are we going to get him nutrition? And one way is to do a surgery in his stomach that allows us to feed him straight through his stomach. We call that a PEG tube. So that's a lot of information, but that's our point of view from the medical side of things.
Thank you, Ben. He wouldn't want this. Sounds like he's never going to get off the machines. He's just not going to get better. He hasn't improved at all over the last weeks. I just don't know what to do. I don't know what you would want me to do.
Yeah.
Sorry, Tina.
You're not going to get any better.
You know, Tina, it sounds like this has been so hard. I wish things were different. He's been on the ventilator for almost 3 weeks now. He has been getting nutrition through his nose, and now, you know, as Ben was saying, you know, we need to start making some decisions as to what's best for him. And I think what I hear you saying is that it sounds like he's not getting better, and I think you're right. So far, he hasn't been getting better, and there hasn't been any sign that he may. And I think based on some of our prior discussions where you talked about how quality of life is very important for him, and that this may not be something that he would want, especially the dialysis. I'm wondering if it may be time to really think about that more closely and see what we can do to help him right now, recognizing that he may not get better. And that his kidneys may not get better, and given that he's not someone who'd want discontinued dialysis. Maybe thinking about stopping dialysis right now. And recognizing that he may be toward the end of his life. And this may be his body saying it's time. And be focusing on making sure that he's comfortable as possible for the time that he has left.
I don't want him to be in any pain.
They're giving him medication to make sure that he's comfortable, and we can optimize that more. And make sure that we don't keep poking and prodding him right now. And just focus on his comfort. We'll stop medications that we think won't be helpful. We'll avoid doing things that won't be helpful, like more blood draws and sticking him and doing other procedures, including dialysis. But making sure that he's continued on the ventilator, because right now we don't want to take that out because he can actually infect other people. And at the same time, just make sure that when his time does come, when he dies, allow him to die peacefully. So there won't be any CPR. Let nature take its course.
I think that would be his wish. I do think that.
We can do that. We can do that.
I wish I wouldn't have to let him go.
And here's the thing, I don't think you're letting him go. I think his body is doing that right now. I think his body is saying where he is and that he may not get better. And I think part of this is helping guide you through this so that we honor who he is and what his wishes would be.
Yeah, we're really grateful to have had you as a part of our team here making these really hard decisions, because you know him better than any of us. We really appreciate you being present for this.
Thank you. Thank you both.
Yeah.
Thank you for helping my father.
Yeah, it's been our pleasure. I think the nurses have been doing a phenomenal job
They
caring
really
for him, making sure.
wonderful. They've helped me be able to see my dad every day with the cameras and.
I'm so glad.
Thank you.
All right, Tina, we are happy to circle back in a little bit. I mean, this is a really heavy conversation, and so take some time. We'll go talk, Dr. Rob, if you don't mind, we can talk about next steps about transitioning to comfort care. And Tina, would you want to see him again on Zoom today before we make any changes? We know this is such a impossibly difficult time with the virus, so we want to connect you in whatever way we can.
I'm scheduled to see him later on today with the nurse, so I would like to keep that appointment.
Certainly.
Thank you.
It's the least we can do.
Thank you.
All right. Thanks for talking, Tina. We'll talk soon.
Thank you.
Intensive Care Unit.
Tina, I'm Chaplain Milton. We met prior on the Zoom call.
Thank you so much for meeting me here. I'm so glad that I could be here in person this time.
Of course, I know this is definitely trying, and whatever I can do to support you right now, I'm here for you.
I really appreciate it. Thank you. Thank you for being here with me.
Are you ready to go in now?
I believe so, yes. Thank you.
Whatever you would like to say to your father, it's a good time for you to say that now.
Love you, Daddy.
You mentioned that his faith is very important to him. Would a word of prayer be helpful to you right now?
Yes.
Holy One, whom we call by many names, we thank you for your grace and your presence, even in moments like this. We pray, God, for Miss Williams as she is in this moment of her father's passing. We pray that your strength will be made perfect, and the love and the memories shared between she and her father will remain in her heart. In times like these, words are far and few, but your presence is welcome. This we ask in your holy name. Amen.